start with introductions while folks are continuing to stream onto this Zoom. So good afternoon, everyone. This is the Joint Standing Committee on Health Coverage Insurance and Financial Services, and we're assembled this afternoon for a pretty good number of work sessions on some bills that we have heard over the last couple of weeks. And we will begin, as we always do, with committee introductions. I will start with Representative Arford.
Thank you so much, Madam Chair. I am Representative Poppy Arford, and I represent District 49, the western part of Brunswick. Thank you.
Excellent. And Representative Quint, go ahead.
Hello, my name is Representative Tracy Quint. I represent House District 144, which includes 13 towns in Aroostook County. Thank you.
Thank you. And Representative Matheson, go ahead.
Good morning, everybody. My name is Christy Matheson, and I represent District 1 Kittery.
Representative Connor.
Thank you, Madam Chair. Good afternoon, everyone. My name is John Connor. I represent House District 58, which is part of Lewiston.
Representative Blyer.
Thank you, Madam Chair. Good afternoon, everyone. My name is Mark Blyer. I represent District 22, which is Leamington and part of Buxton, Standish, and Limerick.
Representative Melrano.
Good afternoon. My name is Gina Melrano. I represent House District 62, which is part of Auburn.
Representative Brooks.
Good afternoon. My name is Heidi Brooks. I represent House District 61, which is part of Lewiston.
And Representative Morris.
Good afternoon. I'm Representative Joshua Morris. I represent House District 75, which is Turner, Leeds, and part of Livermore.
Representative Tepler. You're on mute.
Thank you, Senator Sanborn. Good afternoon. My name is Representative Denise Tepler, and I represent House District number 54, which is all of the town of Topsom.
And I am Heather Sanborn, and I represent Senate District 28, half of Portland and half of Westbrook. And we are, as always, helped today by our clerk, Christian Ritchie, and our analyst, Colleen McCarthy-Reed. As I said, we do have a number of work sessions to get through today, and they fall into some neat categories. And so we're going to take them up sort of in clumps here as we go. So the first set of topics or of bills that we will look at are all related to health insurance health provider billing. And so I'll have Colleen, if you would just pull up your analysis on these four bills, and we'll open the work session on them, and then we'll vote them individually as we go along. And I guess, Colleen, I would say there's a lot of words on the slide about federal law and state law, and I don't necessarily think we have to have it all read out, but maybe can just summarize it. So I'll let you take it from there.
Sure. Thank you. As Senator Sanborn said, for purposes of the work session today, I sort of grouped together four of these bills that relate to billing that providers send for healthcare services or information that is required to be provided to patients about costs of healthcare services. So there are four bills: LD 167, LD 367, LD 951, and LD 1353. LD 167 and LD 367 propose to prohibit healthcare entities from billing patients or charging patients for services when the billing statement has not been provided within 6 months of the date the patient received healthcare services. LD 951 also contains a similar provision prohibiting billing, but that bill proposes that prohibits the billing for a service that occurred more than 1 year earlier, and also would prohibit that healthcare entity from initiating a collection action against the responsible party for that service. LD 951 also has a second provision that would add a requirement in law that prior to receiving services, a healthcare practitioner or laboratory shall inform a patient of the costs of such services, including service fees, facility fees, and other fees or costs associated with providing services to that patient. And then LD 1353 proposes to require hospitals to post on its publicly accessible website the cost to a patient of procedures, services, medications, and equipment, and to provide that information to patients upon request. LD 1353 also provides that a violation of the provision would be a crime. I outlined for you here a number of provisions in current Maine law, but there are some recent developments in federal law and regulation that were brought up at the public hearing that I wanted to just highlight and mention. One is a statutory, regulatory requirement that went into effect January 1 of 2021, requiring hospitals to provide pricing information online about items and services they provide in two ways. One is to provide sort of a comprehensive machine readable file with all of the prices for items and services. And then secondly, a display of at least 300 shoppable services in a consumer friendly format. Also as part of the federal legislation before the end of 2020, as part of one of the relief packages, it included what's called the No Surprises Act. And as part of that legislation, which regulates separately sort of surprise billing, but there was a component in that legislation that beginning for plan year 2022 would require health insurance carriers to provide what's called an advance explanation of benefits upon request to consumers. And they would be able to submit requests and receive back information within 3 business days about whether the provider facility participates in network, and a good faith estimate of what the plan will pay and what the patient will have to pay for services that the patient, scheduled services that the patient has. As I mentioned, there are a number of provisions in current law already that do require disclosure of information by healthcare providers to consumers about the cost of services that also relate to billing. Hospitals are required to provide itemized bills to patients within 30 days of a request. There are provisions requiring hospitals and ambulatory surgical centers to provide information about average charges for inpatient and outpatient procedures upon request. Healthcare entities, and that's a defined term, but it includes hospitals, ambulatory surgical centers, individual physician offices, to provide information about prices of the most frequently provided healthcare services, and also to post information about the MHDO's Compare Maine website. There's also a provision in statute that requires healthcare entities to provide estimates of the total price of medical services rendered during a single encounter to uninsured patients upon request, including information that would help identify any third-party healthcare entities that would be providing services as part of that encounter, and also to notify patients of the hospital's of a charity care policy. And as I think you're aware, we've talked before about provisions that prohibit balance billing for surprise bills and out-of-network emergency services. And then lastly, there are provisions in statute that prohibit patients from, or their insurer from, being charged by a facility for healthcare services provided as a result of or to correct a mistake or preventable adverse event. You received a number of documents that are in the electronic committee file related to the written testimony and some follow-up information on this, these proposals. I think one of the primary questions I think for the committee to think about is whether or not this additional legislation is necessary, given the existing provisions that are in state and federal law in regulation. As drafted, a number of the provisions related to the timely billing focused on the date of service that the date the patient receives those services. You heard a lot of testimony about the impact of insurance providers when a patient has insurance and the time that providers have to wait until that claim is processed. So if you do think about moving forward, you might want to change the focus to the time, the date or the claim is adjudicated rather than the date of service. We've had discussions before too about what is meant by cost. Is it the price of the service, or is it really focused on the out-of-patient costs or cost sharing that the patient might be responsible for after the application of insurance? The bills as they're drafted also would apply to all bills sent to patients, regardless of what type of health coverage a patient has. So you might consider whether or not the focus should be just on patients who have health insurance or particular forms of insurance. The last thing I would mention is the provision in LD 1353 that does have a new criminal penalty. If you were inclined to move that legislation forward, there is a joint rule that requires the Justice and Public Safety Committee to review any new criminal penalties for their impact on the criminal justice system. And I'll stop there, but I'm happy to answer any further questions or talk more about state or federal law and the specific bills as well.
Okay. So at this point, I'm going to open it up for questions for Colleen. Does anyone have questions for Colleen on any of these 5 bills? All right, seeing none, are there comments about these bills? You guys are so quiet. Is everybody awake? All right. I will kick it off. Oh, Representative Tepler will kick it off. Go ahead, Representative Tepler.
Thank you, Madam Chair. And I'm sure you were just going to say some of what I'm going to say, which is there are recent federal laws that address a lot of these issues. Many of them were passed last December, but don't actually kick in till January 1 of next year. But they will affect a lot of these billing practices. And so I think with that, I'll turn it back over to Senator Sanborn.
Okay. Yeah, I would say that, you know, we certainly heard testimony, and I think some of us on this committee have had the individual experience of having a bill arrive very puzzlingly late and unexpectedly as a result. And yet at the same time, I think we also understand that there's often some sort of reasoning behind that that often involves insurance companies. That I'm not sure any of the bills in front of us would really stop that problem from happening as they're designed today. And that the federal government has stepped in here, at least with regard to the bills that are discussing price transparency. I think the last 2 bills that Colleen talked about, and the federal government has really gone further with price transparency than even we had in our Compare Maine and our shopping requirements in prior legislatures. The idea of an advanced explanation of benefits being able to be available upon request, where a provider and an insurance company would have to work together to estimate not only what the charges would be, but how the insurance would apply and what the copays and deductibles would be for any particular procedure, is a really exciting development. I'm sure it's one that providers and insurers both probably lobbied against at the federal level, but it has become federal law. And I think I want to be careful not to piecemeal legislate requirements that are sort of similar, but out of sync or out of step with the new provisions of federal law that are coming online over the coming months. Representative Morris?
Yes, thank you, Madam Chair. I would concur with everything that you, as well as Representative Tepler, said. I think I will note that I did notice in terms of the sponsors and supporters of these bills, you had a fairly broad cross-section of people within the legislature in terms of ideologically, that I think it shows that this is an issue that is of great concern to all our constituents and to everybody across the political spectrum. But I agree, I think there are federal laws that are coming up that rather than trying to create a patchwork, it makes more sense to wait and see what happens with the federal laws before we try to move to do anything different. So.
Are there any additional comments on these? Okay, so with that, the first bill is LD 167, and that bill is titled An Act to Limit Late Medical Billing to 6 months, and I would entertain a motion. Representative Tepler,
I will move ought not to pass.
is there a second? Representative Connor has seconded, and the clerk will call the roll.
Representative Quint. We'll mark Representative Quint as absent because she can't turn on the camera. And then Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Excellent. The next bill is LD 367, an act to require timely billing for healthcare services. And I would entertain a motion. Representative Morris.
Thank you, Madam Chair. I would move ought not to pass.
Is there a second? Representative Tepler has seconded Representative Morris's motion, and the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That is 10 yes, 3 absent.
And the next bill is LD 951. This was titled An Act to Improve Transparency of Medical Billing. Pardon me, I would entertain a motion. Who wants to move it? Representative Matheson.
I'll make a motion ought not to pass.
Okay, and is there a second? Representative Blyer has seconded. Excellent. Love the bipartisan work. Thank you. And the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Okay, and then the last one in this grouping is LD 1353, an act to require the public posting of costs of medical procedures, services, medications, and equipment delivered in hospitals and the reporting of those costs upon request. And I would entertain a motion. Representative Connor.
Madam Chair, I would move LD 1353 ought not to pass.
Is there a second? Representative Matheson has seconded Representative Connor's motion. And the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Okay. I think the next bill is LD 530. Is that the next one you've got up, Colleen?
Sure, I have them all up, so I can
Great.
go in whatever order you want.
All right, let's do LD 530. We're still kind of sticking with this concept of
Sure.
medical billing, but shifting away from the providers piece over to a slightly different spin on the topic. So Colleen, you can go ahead.
Yes, LD 530 is an act to consolidate patient bills by directing health insurers to collect payments and deductibles. It seeks to clarify that cost sharing amounts in health plans that are owed by enrollees must be collected by carriers by issuing one consolidated bill for each episode of care. It would require carriers to make guidelines for cost sharing collection available to enrollees, including posting on its publicly accessible website. As drafted, the bill would prohibit carriers from inducing or incentivizing a provider to collect or an enrollee to pay cost sharing amounts directly, and would prohibit carriers from discontinuing coverage for failure of an enrollee to pay any cost sharing amount. The bill also states that carriers are not required to collect cost sharing amounts applicable to healthcare services delivered by a pharmacy provider in an outpatient setting. And as it's drafted, it would apply to health plans issued or renewed in Maine on or after January 1 of 2023. So there is some lead time anticipated for implementation and compliance as the bill is drafted. There were a number of sort of questions raised that I would just throw out there for the committee to consider, mostly related in terms of kind of clarifying the language in the bill and implementation if the committee chooses to go forward. One of the things to keep in mind is as the bill is drafted, the requirements would apply to only to fully insured individual and group plans and other plans regulated by the state, primarily multiple employer welfare plans. But the provisions would not apply to Medicare, Maine Care, those covered under self-insured plans, federal benefit plans, those covered under military or veterans coverage. Also as drafted, it wouldn't apply to any workers' compensation insurers or automobile insurers that would be responsible for making payments for healthcare services. So while it would assist, I think, providers in one instance with the collection of cost sharing amounts for those who are covered under fully insured plans, providers would still be responsible for the collection of cost sharing for folks who are covered under those other types of plans I mentioned. So, you know, I guess the question is, how would this benefit providers and patients? It would in this, for this one category of folks who are covered under health insurance. Carriers' testimony indicated a lot of questions about the potential impact, both administrative costs and changes to information systems, whether this might affect reimbursement rates, what impact it might have on insurance premiums, and given their requirements for medical loss ratio, the ability of carriers to account for any additional costs for implementation. They also asked questions about what impact this might have on responsibility for bad debt from uncollectible bills. Is that shifting that from insurers to insurers from hospitals and other providers? Also some concerns about, you know, what exactly is meant by episode of care in the bill. Would that need further clarification? Or if the legislation moved forward, would the committee consider some rulemaking provision or something which isn't in the bill as drafted now to the Bureau of Insurance to sort of develop and sort of operationalize this proposal? Also, as drafted, it appears to apply to all providers. So the questions were asked about whether or not this would impact just providers who are participants in a health insurance carriers network or to all providers. And questions also were raised in testimony about potential impact on existing eligibility for charity care through hospitals. We don't yet have any fiscal information about the bill if it moves forward, but I would note that the Maine Hospital Association forwarded some information as a proponent of the bill, sort of providing some follow-up and potential answers to some of the questions that were raised in the bill analysis, and that was emailed out to you earlier. And I'm happy to pull that up if the committee is interested. I also think I haven't looked quickly at the attendee list, but I'm sure there are representatives who could also speak to that if you have any further questions. I'll stop there.
Thank you, Colleen. So are there questions for Colleen with regard to this bill, LD 530? So I'll start the conversation, which is to say that I find this idea very intriguing, and I understand the impetus for it entirely, but I also find it really worrisome, because I know that if I got myself into a place where I had a chronic illness and started to fall behind on my medical bills, I would not want to be in a position where I was in debt to my insurance company and therefore potentially in danger of losing my insurance. And while this bill provides that the insurer can't cut me off, I think at some point that becomes an untenable possibility. And I'd certainly much rather owe money to a nonprofit hospital. We're very lucky to have nonprofit hospitals in Maine, but I'd rather owe money to them than to a large multinational insurance company, or at least national insurance company. I suppose they aren't really multinational, but a large insurance company that, whose mission is not to provide health, but instead to provide profits to shareholders. So that's sort of my skepticism about the bill. I think it also has some fundamental incompatibility with our clear choice design plans, because it might push insurers to offering no deductible plans or no copays, and having to really rethink copays and deductibles entirely, because the insurers are not going to want to be providing a billing service for the providers. And I think it just puts us into a place where it turns our insurance market upside down. I guess I would also note that, when I have a car accident, I do have to pay my deductible generally to the person that's repairing the car, and not to the insurance company. That's generally how that works. So I think this is the way that insurance works most of the time, that the provider of the services has to bill for the portion that's not covered by insurance, if not for the whole amount, and then the person just gets reimbursed by their insurer. Representative Tepler, go ahead.
And I want to say I agree with everything that you have said, Senator Sanborn, but I do want to add that I really understand providers' interest in this concern. I mean, it takes us back to the old days when we actually paid our provider and then didn't have this whole complicated system of having insurance, paying a copay, and then paying the insurance company for something and the provider for something. And yeah, sure, it would be really nice to just be able to write one check. But I think that there's a balance in the way that responsibility is distributed right now in the system. And it does increase costs for everybody. So I understand why providers might want to bring this forward, but also see why it's truly untenable for the reasons that you named.
Representative Morris.
Thank you, Madam Chair. Yes, I will be opposing this bill as well. I think I understand a lot of what you have said, and I think that, but I think part of the concern I have with it is part of the issue. The real concern I have with our healthcare system is how much we have separated the provider and the patient, and had the insurance company in between. And I think having more, this does nothing to kind of bring that relationship closer together. And I think that it really becomes problematic for that situation. With that, I will move on not to pass.
Thank you, Representative Morris. This doesn't cut off debate, but is there a second for his motion? Representative Evans, was that a second?
Yes.
Great. Representative Arford, go ahead.
Thank you, Madam Chair. I want to recognize my colleagues on the committee for their thoughtful comments. And I agree wholeheartedly with what Representative Morris has just stated about moving the relationship between the provider and the patient further apart. And it is in direct, almost opposition to the new federal laws, which we will be talking about, that require providers to offer much more price and cost transparency to patients. And it will be, if we were to pass this legislation, not only does it apply to just maybe 30% of the insured population in our state, but also they would be getting price transparency at the provider, but then not paying anything to them, getting their bills from the insurers, who knows how longer after they receive the service. And who would they go to if the price that was advertised or made available at the providers did not match up with the price that they were billed? I mean, to me, the complexity this adds to an already outrageously complex system is untenable. But at the same time, I do appreciate people's efforts to try to do something to fix a broken billing system from the patient's perspective.
Are there additional comments? All right, so seeing none, we do have a motion on the table on not to pass, and the clerk will call the roll.
Representative Quint. Representative Quint absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans. Representative Evans, you're muted.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
All right. So the next bill that we will turn our attention to is LD 1341, an act to protect Medicare beneficiaries from surprise medical billing. And I'll ask Colleen to do her presentation.
Okay, so here's LD 1341. As Senator Sanborn said, it is directed at Medicare beneficiaries. The bill as drafted would prohibit physicians from charging or collecting from Medicare beneficiaries any amount in excess of the reasonable charge for a service, procedure, or treatment paid to that physician under the Medicare program. It also would require physicians to post notice of these requirements in their office, and provides authorization for individuals to file a complaint with the Board of Licensure in Medicine concerning any violation of the provisions. As explained by, I think, the sponsor and both the proponent that you heard from at the hearing, the intent of the bill is to prohibit excess charges from being imposed on Medicare beneficiaries by physicians for services covered under Medicare Part B, which are generally sort of outpatient services, as opposed to Part A services, which are hospital and inpatient services. Current federal regulations do prohibit physicians that accept Medicare assignment from billing for excess charges, but those physicians that do accept assignment may bill up to 15% for that excess. National data does demonstrate that 96% of physicians participate in Medicare and so would accept assignment. So the bill as drafted would really focus on those physicians who are not currently accepting assignment. Further, there are 2 standardized Medicare supplement policies that do provide coverage for excess charges for those folks who purchase are covered by sort of Medicare Part A and Medicare Part B, and then choose to purchase a Medicare supplement policy to provide additional secondary coverage. There are also Medicare Advantage, or what's Part C plans that are also available in the marketplace that would prohibit balance billing. As you heard at the public hearing, there are some states that have taken steps to address excess charges in some manner. I highlighted 4 of the sort of closest states to Maine to give you some examples of how they have addressed that and provided links to their statutes. Rhode Island makes agreeing to treat a Medicare beneficiary and then charging or collecting any amount in excess of the amount permitted by Medicare unprofessional conduct under its physician licensing provisions. Massachusetts law has a provision that requires physicians as a condition of granting or renewing their certificate of registration, that a physician agreeing to treat a Medicare beneficiary must also agree not to charge or collect any amount in excess of the amount permitted by Medicare. Vermont law prohibits balance billing except under certain conditions and unless the Medicare beneficiary agrees to balance billing. Looks to me like parts of LD 1341 are based somewhat on some of the legislation in the current law in Vermont. And then lastly, Connecticut, as an example, requires physicians to disclose prior to delivering services whether or not the physician accepts Medicare assignment. So there's a range of how states have treated it. And I think one of the questions that was raised at the public hearing was why this provision was placed in the licensing statutes. And I think in part it's because it's modeled after some of the actions that have been taken in other states. As I mentioned, Rhode Island, Massachusetts, and Vermont all place their provisions within their sort of physician licensing statutes. I think if you do move forward, you might consider some technical changes to clarify the intent, which I think is to apply to those non-participating providers in Medicare, and also to focus maybe more specifically on the Part B excess charges. I think you heard some concerns raised at the public hearing that the current language and how balance billing, the term balance billing is defined in the bill as drafted, could be interpreted to prohibit physicians from charging allowable co-payments and deductibles with regard to folks who have Medicare coverage or Medicare supplement coverage. You might also consider, you know, similar to what Connecticut has done in sort of providing or requiring notice to be provided to beneficiaries as an alternative. Also, the bill as drafted applies only to allopathic and osteopathic physicians. So while other states have focused their statutes on physicians specifically, it was suggested that you might consider thinking about other types of providers that might be included, physician assistants or others that might have the ability to provide these services. Lastly, I'll note that the fiscal information we received is that any additional costs to the licensing boards to implement the requirements of the bill can be absorbed within their existing budgeted resources. And the last thing I'll just remind you of is, and I didn't include it in the analysis here, is that members who were on the committee last session might recall legislation that you considered that Senator Claxton sponsored that was enacted that would require notice to Medicare beneficiaries of the observation status requirements related to Medicare. So there was provisions, sort of the concept of focusing on notice or providing advance notice of the potential for, you know, additional charges was something that the committee considered and enacted last session when you enacted, it's in Title 22, but it's Section 1718F, specific to that disclosure about observation status under the Medicare program. And I'll stop there, and I'm happy to answer any questions you might have.
Are there questions for Colleen? All right, so not seeing any, I will kick us off again with some comments on this bill, which is that I actually think that there's quite a lot of limits and protections on balance billing within Medicare already. And some of those limits are that non-participating providers that accept Medicare patients can only bill up to a capped amount, which is 15%, I think, above the Medicare rate. So that's in federal law already, as Colleen explained. And that there are also products available that people can buy to ensure that they're insured against even that 15% excess if they want to buy that, which they might do if they knew that one of their providers was a non-participating provider, I think. And then I guess the other piece of it is that 96% of all physicians in the country are participating providers. So I'm just not clear on who we're protecting or what the urgent need for this bill is. And then I guess I would also comment that that I don't think that the bill in its currently written form is quite on point for what it would need to say in order for us to pass it, and that it would require quite a bit of committee amendment, which I'm not sure is a high priority for us at this point in the session. Representative Tepler, go ahead.
Thank you, Madam Chair. I was unmuting and muting myself at the same time. I had a very cordial conversation with the sponsor this morning. He understands fully that this bill really does need some more work to be ready for prime time. And he and his constituent who created his concern about this issue are going to do that work and bring this bill back either in the next session or in the 131st legislature. So I am willing to make a motion ought not to pass and leave it at that.
Okay.
Second.
Are there, okay, seconded by Representative Connor. Pardon me, are there any other discussion? Anyone else want to make any comments on the bill or discuss it further? All right, seeing none, the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Okay. The next bill that we will pick up is LD 1349, an act to increase transparency in dental billing. And I'll have Colleen do her presentation. We'll
do LD 1349 as drafted. This bill requires a dentist, independent practice dental hygienist or denturist to provide notice to a patient before services are rendered of any charge for procedure, equipment, materials, or other measures necessary to protect the health and safety of patients and staff during a public health emergency, such as a pandemic or other outbreak of infectious disease. As drafted, the bill requires notice be provided of a charge before services are rendered. If the intent is to require a disclosure of the amount of that charge, you might consider clarifying the language in the bill, and also consider that the amount of any charge is not limited in any way if the committee wants to provide some sort of guardrails or parameters for the amount or the extent to which an additional fee may be charged. Concerns were expressed in part of the testimony about an inability to estimate costs in advance, and that such a provision would be difficult to implement because of changing prices and demand for PPE equipment, and think about whether or not the bill is necessary. The Board of Dental Practice did indicate in their testimony that while they did receive some consumer inquiries and complaints early on during the pandemic, they haven't received any recent complaints since late summer. The committee did ask for some follow-up information from the Maine Dental Association about whether dental practices are currently adding fees or charges associated with personal protection equipment. And you did have some, Angela Westoff provided some information, which is linked here, but it was also emailed to you. They did do a quick survey and had 156 responses to the survey. And with regard to the question about whether currently dental practices are charging or adding any additional fees related to PPE, of 156 respondents, I think the information from Ms. Westoff indicated 150 of them are not adding any additional surcharge. The Board of Dental Practice did indicate in their testimony that in response to the prior inquiries I mentioned, that there isn't any state law that prohibits these charges. And they did note that if the intent of the bill was to require information with regard to costs of treatment, current board rules do require that estimated fees related to a dental treatment plan be reviewed with the patient prior to commencing treatment. And lastly, the board did suggest that there are some issues potentially with investigation and enforcement of the provisions in the bill as drafted. They only have authority over individuals licensed by the board. If dental services are provided in other settings, they would lack authority currently. And you might, if you're interested in moving forward, think about shifting this or thinking about it in the context of an unfair trade practice that would be subject to enforcement by the Office of the Attorney General. We don't yet have any fiscal information, and I'll stop there, and I'm happy to answer questions. I do think that Ms. Westoff is here if you have any follow-up questions about the information that she provided in the survey of dental of members of the association.
Thanks, Colleen. I did want to thank Ms. Westoff for quickly putting a poll in the field to her members and getting us that timely information. My sense of the matter on this bill is that it was an issue that arose very quickly when we hit a shortage of PPE last summer, but it has largely resolved itself now. And that the amounts of the surcharges were relatively small, though certainly frustrating and onerous for the folks who didn't expect to encounter them during those first couple of months of crisis after dental offices reopened, but that the bill is basically not all that timely at this point, particularly because unless we add an emergency clause, it wouldn't go into effect until sometime late this fall. When hopefully much of our population will have been vaccinated and PPE is probably much more widely available at more reasonable costs than it was a year ago. So that's my sense of the matter. I want to open it up to other members of the committee for additional comments. Don't all speak at once. All right. If nobody else wants to talk, perhaps someone could make a motion. Representative
I will move up.
Oh, Representative Morris, go ahead.
I was just going to move on not to pass.
Okay, and Representative Matheson seconds the not to pass motion. Is there any further discussion? All right, Representative Arford, go ahead.
Yeah, for what it's worth, I just want to make the comment that, thank you, Madam Chair.
Yeah.
That although I agree at this point with your assessment and not going forward with this bill, it's important that patients understand they can always question a charge, especially one that is unusual and that they have not seen before, such as one of these charges would probably be. And it did happen to me that I had a PP charge, which I questioned and they withdrew. So I just want to encourage people that they do have options, even though we're not passing this bill.
It's a good reminder. And important for people to know that they can't always call their provider and negotiate. Are there any other comments? All right, seeing none, we'll ask the clerk to call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Okay. Great. The next, Colleen, I forget, did you do one analysis for the next 3 bills altogether for the dental bills? Yes, you did.
For the three
board
dental
bills.
board
Yeah.
bills, I grouped them together, yes.
Great. So why
Wanna
don't
move
you
to
walk
those?
us, yeah, let's walk through those.
Sure.
And we'll go through those next.
I did group together for purposes of your discussion, 3 bills that were submitted by the Board of Dental Practice, LD 25, LD 26, and LD 76. LD 25, as drafted, would authorize the board to consider the educational equivalent of a doctoral degree in dentistry in determining the educational qualifications of an applicant for a resident dental license who has graduated from a dental program not accredited by the American Dental Association Commission on Dental Accreditation. It would require further an applicant for to be a dental resident in Maine to pass only a jurisprudence examination, which would focus on specifically on Maine statute and rules, and it would add a requirement that the provision of dental services by a dental resident be provided in a board-approved setting. LD 26 authorizes within a dentist scope of practice the use of Botox or dermal fillers when supported by a patient's diagnosed dental condition or as part of a patient's dental treatment plan. It also adds additional grounds that the board may consider when taking disciplinary action against a dentist to include administering Botox or dermal fillers to a patient for a non-dental condition or treatment. And it also, primarily what the bill does is places into statute the limitations on a dentist's administration of Botox or dermal fillers that were formerly in a board rule that has since been repealed. And finally, LD 76 implements the recommendations of the Board of Dental Practice that were included in a report back to the committee last session, and it was also embodies statutory language that was considered by HCIFS and reported out last session, but not that legislation was not fully enacted. So there are 3 primary areas where LD 76 makes changes. It makes changes to the definitions of direct supervision and general supervision, and makes corresponding changes to the activities that may be performed under general or direct supervision by persons licensed by the board. It makes changes to provisions governing the delegation authority of dentists to unlicensed persons and dental assistants and to persons licensed by the Board of Dental Practice. And finally, it adds a specific definition of teledentistry and would authorize oral healthcare services and procedures to be provided through teledentistry in accordance with rules adopted by the Board of Dental Practice. All 3 of the bills are drafted as emergency legislation, so they would take effect when signed by the governor if enacted with 2/3 vote of the House and Senate. LD 26, there was a technical amendment that was submitted by the sponsor on behalf of the Board of Dental Practice to clarify that the language related to the administration of Botox or dermal fillers is not intended to restrict the existing practice of oral surgeons. But I did want to note that with regard to LD 26, although there was no testimony provided at the hearing, there was written testimony submitted by representatives of the American Society of Plastic Surgeons, suggesting you amend the language further to prohibit the use of Botox explicitly for cosmetic purposes and by dentists, and to remove reference to a dental treatment plan. And with regard to LD 76, you also received a technical amendment put forward on behalf of the Board of Dental Practice to retain the authority for a dental hygienist to apply desensitizing agents and to apply fluoride to control caries in teeth. And those were provisions that were inadvertently removed when the bill was printed. So the intent of the technical amendment is to put that language back into statute. With regard to LD 76, you did have some opposition to some of the changes that were brought forward by representatives of dental hygienists. They objected to some of the changes that related to removing the specific list of activities that may be delegated to unlicensed persons. Some of the changes related to expanded function dental assistants. They objected to removing language related to requiring direct supervision for certain activities, and to the changes related to supragingival polishing. And they also objected to some of the changes relating to removing language in current law that lists some specific activities that are within the scope of practice for dental hygienists. The Board of Dental Practice did provide some additional information following the hearing in response to those concerns raised. And my understanding is that the board supports the bill as printed with the technical amendment, and would prefer to address the concerns raised by the dental hygienists through some additional stakeholder process and consultation, rather than addressing them in the legislation that you have before you. But you do have representatives of both the dental hygienists and the board here if you have any further questions. And then lastly, with regard to all of these bills, the fiscal information indicates that any additional costs affiliated to the board to implement the requirements can be absorbed within their existing budgeted resources. I'll stop there, and I'm happy
Thank
to
you,
answer any
Colleen.
questions.
Yeah, thanks, Colleen. Are there questions for Colleen? And Colleen, can you just remind us, LD 76 is basically the same as a bill we passed unanimously last session?
It is. That's what I mentioned. It was
Okay.
LD 2146. And it incorporates the recommendations made in that bill as printed and amended by the committee.
Great. Okay. So
I'm sorry.
let's go ahead, Representative Evans.
Clarification, amended by committee or by the board?
By the committee last
Okay,
year.
thank you.
Yeah, last session following public hearings last year. Okay, so let's take these one at a time, as they are all actually a little bit separate. So we'll focus first on LD 25, which is an act to modify the qualifications for resident dentist licensure. Are there any comments on this particular bill proposed by the board? Seeing no comments, I will comment that I think this bill just opens up opportunities for folks to seek advanced dental training in Maine, which might allow us to attract them to make their homes here and provide dental services throughout their career here. So I think this is a great bill, and very pleased that the licensing board brought it forward. Are there any other comments? All right, so with that, I'll move ought to pass. It doesn't need to be amended, Colleen, just straight ought to pass. Okay, and Representative Tepler seconded the motion. Any further comments? Seeing none, we'll have the clerk call the roll.
Representative Quinn. Representative Quinn is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Next, we'll shift our attention to LD 26, an act to allow a dentist to administer Botox and dermal fillers. And Representative Tepler, go ahead.
Thank you, Madam Chair. And Colleen, I just have a quick question for you around the issue of oral surgery and the things that are mentioned by the other physicians who commented. To me, it seems pretty clear the rules that the board has drawn up here that are going to be placed in statute. Do you think there's any need for further clarification that we're talking about not allowing dentists to do cosmetic procedures?
I think, I mean, you could probably ask the board, but my reading of it, I think, is that it's pretty clear, and it also gives the board the authority that if someone is not providing services in accordance with the explicit language in the statute as drafted, not acting outside of what the authorization is, that then the board has the ability to take action. So I'm comfortable with the language as drafted, but I don't know if the board has any further comment.
Representative Tepler, do you want me to bring in Ms. Valancourt? Or are you good?
I think I'm good, and
Okay.
I think that the only other piece of that is the language, the slightly technical changes to the language, allowing appropriate use for the surgeons, the oral surgeons, and that's all I'm concerned about. Is has the bill been made to work the way it's supposed to?
Mm-hmm. Okay. So did you want to make a motion?
Sure. And given that I've had that reassurance, I would move ought to pass.
Is it ought to pass as amended?
It is amended.
I'm
yes.
sorry, as
to
amended.
do that, add that clarification you mentioned. Yes.
Great.
I'll second.
Okay, so it's been moved and seconded by Representative Connor, and I don't see any other hands up, so the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, Representative Brooks. Yes. Sorry. Representative Brooks. Yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
All right. The next bill then, in the last of this grouping is LD 76, an act to amend the Dental Practice Act and define supervision to define supervision and authorize teledentistry. So this was a bill that we passed unanimously last session. There is one technical amendment to add back in a couple of lines that were inadvertently deleted that the board agreed were not intended to be deleted. But I did want to just address the comments that we received from the dental hygienists with regard to some other deletions that they believe are in error, and just sort of say that I think we have to be careful about what level of detail we capture in our statute with regard to licensing, as opposed to what level of detail we leave to the rules, which can be amended or changed or updated in a more timely way, because the boards can propose new rules at any time of year, whereas statutes really can only be edited by the legislature through a very lengthy process that we are now in the middle of. But the opportunity to edit them doesn't really come around all the time because we're only in session part of the year, and then because there are deadlines for submitting bills for the whole 2-year session that have already passed. So those are some of my rationale for not wanting to micromanage which words belong in statute versus in rule. So trusting the board on that front to decide that certain lists should be in rule rather than statute seems like prudent lawmaking to me. So did want to address those comments. Are there additional comments from the committee? Representative Matheson.
Yes, thank you, Madam Chair. And I would concur with you. I agree with everything that you said, and I also wanted to add that I am the sponsor of this bill, and I have constituents that had concerns about this that were dental hygienists, and I feel comfortable with the way that the Maine Board of Dental Practice handled those concerns. They spent about an hour on a Zoom call with me and my constituent trying to explain some of these concerns, and also they responded appropriately to all of the concerns that were raised in the testimony. So I will be voting ought to pass for this bill.
Are there any other comments? All right, Christy, Representative Matheson, would you like to make the motion?
Sure, yes, I make a motion ought to pass as amended.
Great, is there a second? Seconded by Representative Evans, and the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Okay. The next bill that we will pick up is LD 1120, an act to allow dentists to receive continuing education credits for uncompensated volunteer work. And Colleen, why don't you do a presentation for us?
Oh, here we go. Here's LD 1120. This bill, as Senator Sanborn mentioned in the title, it would allow dentists to receive continuing education credit for uncompensated volunteer dental care. The language of the bill would limit the credit to no more than 8 credit hours per year. Under current law, continuing education requirements for licensees of the Board of Dental Practice are set in rule. By rule, dentists must complete 40 hours of continuing education credit every 2 years, and there are a variety of activities that qualify in sort of settings that would qualify for continuing education credit. The Board of Dental Practice's testimony indicated also that the recognition of volunteer work has been considered previously by the board as part of their rulemaking process on continuing education, but has not been incorporated or adopted into rule. So one of the things to consider is sort of kind of building upon what Senator Sanborn said in relation to your previous discussion, is consider whether changes to continuing education requirements should be done through statute or through rulemaking. And as I mentioned, the current practice is that determination about the number of hours and how what types of things qualify for continuing education credit is done through rules. As drafted, the bill's provisions do only apply to dentists. So If it is something the committee is interested in, you might consider thinking about allowing this type of credit for other licensees of the Board of Dental Practice, not just dentists. One of the concerns raised was about the impact of sort of allowing a reduction in the continuing education hours that might be spent on clinical areas of practice or standards of care. And also concerns raised about how dentists would account for and report these hours to the Board of Dental Practice. You do have the fiscal information indicates that the board can adopt any additional costs can be absorbed within their existing budgeted resources if this legislation moves forward. And lastly, I'll just say that I'm not aware of any other licensed professionals that have a statutory requirement that would provide credit for volunteer services.
Thanks, Colleen. Are there questions for Colleen? Representative Mora.
Yes, thank you, Madam Chair. It's really just a clarifying question on the last bullet about that right now. Of the credits. How are they generally tracked now? Because I know with my credits for real estate, I'm responsible for keeping track of them, and it's just when I file, if they want to audit me, then I have to prove that I got all the credits necessary. It must be different with different professions. Is that what the issue is there?
I think it can differ depending on the profession. I think certain professions, like if you attend sort of approved courses of continuing education credit, you may often receive like a certificate of completion that can then be paperwork that would be documented that you could maintain and then report to the board. I think typically my understanding would be that it would be similar process for the Board of Dental Practice. There'd be some sort of attestation or affirmation as part of a application for a license renewal that the requisite continuing education requirements have been completed. And I'm not sure if they ask for any additional documentation beyond that, but I think you're right. There'd be an obligation to maintain that documentation. So if there was any follow-up, it would be on the part of the licensee to demonstrate the completion of those hours.
Thank you.
Mm-hmm.
Okay. Are there any other comments about this bill? Representative Tepler.
I would love to comment, Madam Chair, that I like the idea of encouraging professionals to participate in volunteer work. I'm not sure that setting this in statute for CEUs is the way to go, but that I would, while we have Ms. Valancourt here, say to the board, if there are other ways that you can, through rule, encourage volunteer work among dental professionals, that would be great. We would like to see that. And we would encourage all professional boards to do that. So thanks. That's pretty much it for me for comments.
Great. Representative Connor, go ahead.
Thank you, Madam Chair. Yeah, I echo Representative Tepler. I am all in favor of incentivizing and getting people out there to volunteer. I'm not a fan of putting things like that into statute. And I would agree with her wholeheartedly, but I love the idea of it and love the thought behind it. But I think I would rather see them out there volunteering regardless if they're getting credit for it or not.
Mm-hmm. Representative Evans.
Thank you, Madam Chair. I agree as well on the volunteer aspect. I think, however, on the other hand, the use of volunteerism is an inappropriate use for continuing education.
Okay, so getting the sense of the committee, I will take a chair's privilege and suggest a motion of ought not to pass. Is there a second? Representative Connor has seconded the motion, and the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Barford.
Yes.
Representative Barford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
All right, so the next bill we'll pick up is LD 1457, an act to improve access to dental hygiene by authorizing dental hygienists to perform dental hygiene diagnoses. Very proud of myself for reading all of those words. A little bit of a tongue twister. I will have Colleen do her presentation.
Sure. So here is LD 1457. This is a bill that did have an amendment that was presented to the committee by the sponsor, Representative Grabowski. The intent is to add dental hygiene diagnosis to the procedures a dental hygienist, independent practice dental hygienist, and a public health dental hygienist may perform under the general supervision of a dentist. It also would provide authority for a dental hygienist to provide local anesthesia under general supervision. And it retains in current law the authority for a dental hygienist to administer nitrous oxide under the direct supervision of a dentist. As drafted, the bill recognizes that dental hygienists, as I mentioned, perform dental hygiene diagnosis as part of their scope of practice. There are 2 states that include a similar definition in their licensing statutes. And then with regard to the second change, which changes the level of supervision for administration of local anesthesia under current law, both local anesthesia and nitrous oxide is under the direct supervision of a dentist. And what LD 1457 seeks to do is to change the level of supervision for local anesthesia from direct to general. And so one of the questions that was brought up at the public hearing was, how to consider making a change like that to a scope of practice, and does it merit further stakeholder discussion before the legislature moves forward? The Board of Dental Practice indicated their preference that you defer further consideration of what's proposed in LD 1457, so that there could be further discussions by a stakeholder group that could then make some recommendations to the board and bring that back to the legislature. They used a similar process, a stakeholder process, when bringing forward the recommendations for changes that were included in LD 776, which you just discussed previously. As I mentioned, the proposal does change the level of supervision, and is it an appropriate change to their scope of practice? I did include a link to information from the American Dental Hygienists Association indicating that there are 9 states that currently do permit local anesthesia under general or indirect supervision. The remaining states require direct supervision by a dentist in terms of the authority or the scope of practice of a dental hygienist to administer local anesthesia. And then lastly, I'll mention that the fiscal information indicates that any additional costs to the board can be absorbed within their existing budgeted resources if this moves forward.
Thanks, Colleen.
Yep.
Great. So comments on this bill? I had expected that the sponsor might be joining us to make some comments, and I don't see her. Did you hear back from her, Representative Tepler?
No, and I tried making an audio call as well as texting her, so I
Okay.
don't know what the issue is. I do know she had hoped to make a few comments. I know that there is concern that the process of rulemaking for dental hygienists that's been going on has been, slow. And, we understand we wanted a full stakeholder process for all of this. And we understand that, but I think this bill is prompted by the concern that that process has been very slow. It's not the way necessarily we want to do things. We would prefer this sort of thing be in the process of rulemaking. So I am inclined to move ought not to pass on this bill, but suggest that the committee consider a letter to the Board of Dental Practice asking them to, I'm not quite sure how to phrase this, but get a move on in promulgating the rules for dental hygienists. So that's really, I think, where I'm at on this bill, and I believe it's the sponsor fully understands that.
Thank you, Representative Tepler. Representative Matheson.
Thank you, Madam Chair, and thank you, Madam Tepler. I would concur with you, Madam Tepler. I think, did I say Madam Tepler?
Yeah, a couple times.
It's really funny. We were in session a long time yesterday. Sorry about that. I would also say that I have heard from many of my constituents that are dental hygienists, and that a move on with this would be very appreciated. So not a mandate, but a real strong suggestion to get this done, I guess is the best way to say it. Thank you.
Yeah, I think I'm going to actually invite Ms. Valancourt in just so that we can see her face and get her response to the request that this be expedited. So we'll have her join us. Representative Tepler, you're on mute. You may speak.
Thank you, Madam Chair. I just want to interrupt that. Unfortunately, the sponsor just got back to me. She is presenting a bill right now, this very second in EUT. So she's struggling with the being in two places at once problem that many of us have been encountering.
Yeah.
I would love to be able to tell her we'll wait for her, but I don't think that that's possible.
Yeah, I think that may be the case, but let's hear from Ms. Valancourt. Ms. Valancourt, you've kind of heard the sense of the committee and seen some head nods. Can you give us a sense of your timeline and how quickly these rules could be revisited and finalized?
Sure, no, I appreciate that. And I think this is an important distinction I think I need to make to the committee. First of all, in terms of expediting, we have been, I think I've used this phrase in front of the committee before, we have been sprinting a marathon for 6 years to work on this. This is one of the final phases. We cannot, by rulemaking, change scope. That's why we keep coming back to you. This, to me, is a phased approach. We have to come back to you with legislation on this. We cannot adopt this through rulemaking. I think the discontent you may be hearing is they may not like the outcome of that stakeholder process. But again, this committee was very clear to me through our government evaluation report to utilize the stakeholder process. You need the best minds at the table, not just the board or one association. You need the educators, you need the FQHCs, you need the public and the advocates. That is what we've been perfecting for 6 years. Give us a chance to do that. We've got to do it on teledentistry. We'll do it on the RDH scope, but it is not the time. So we asked you to pause. We're ready to do the work. We're not afraid of that work. We expedite as soon as we, as best possible. And in fact, LD 76 was a report back to you during the second session, and the committee was successful in reporting out a bill. We will work as hard as you want us to and report back. But I think we have to honor the other individuals who have been working side by side with us on these issues through that stakeholder process. So I'm confident we can get something back to you, and yes, we can expedite as much as possible. So if I can answer any other questions, I'd be happy to.
Representative Tepler.
Thank you, Ms. Valancourt. I do appreciate the stakeholder process. I think it's really important, and I think, you know, you've done a great job. I think the frustration on the part of the dental hygienist is coming at the end of this 6-year process, that other parts of the oversight were done earlier. So I just, you know, I suspect that that's part of the frustration you're hearing and seeing, and I do think it's understandable, but I will continue to trust in the process, and just understand their frustration that they came at the end along with the teledentistry.
Actually, and if I could just clarify for the committee, I think that's what I'm trying to express to you. That is so not true. The board reported out to the committee 4 years ago a change on the RDH scope. So I have to stand here on behalf of the board to say, to the contrary, we recommended that change 4 years ago and recommended the same change a year ago. So part of the committee's bill that it reported out or amended last year included a study for the board to come back. So this is not reflective of the board at all.
Okay. Then
Thanks for the opportunity. No, I appreciate it. So do I get a little heated and a little salty about it? Maybe, but we have been working so hard on this that we'll take criticism, but not the undue criticism. We have to stand up for ourselves.
That seems very reasonable, Ms. Valancourt. I have no objection.
Thank you.
Good for you.
And I guess I would also just remind folks that the pandemic did delay our work as a legislature for a year, and I'm certain also delayed stakeholder processes as we all learned how to continue to interact with one another despite being locked in our homes for months. So I can appreciate that piece of the challenge that the board has faced in recent years as well. So thank you, Ms. Valancourt. Now I'm confused. Is there a motion on the table?
There is a motion, but no second.
Okay, so we need a second. I see Representative Blyer's second. And so I think it's on not to pass with a letter, and perhaps in light of what Ms. Valancourt has said, the letter doesn't need to be quite as salty as it might have been, but just asking or expecting that we will see a bill back or a report back soon, and then we can report out a bill. Yeah. So with that, we have a motion and a second, and the clerk will call the roll.
Representative Quint. Representative Quint, absent. Representative Connor.
Yes.
Representative Connor, yes. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans.
Yes.
Representative Evans, yes. Representative Arford.
Yes.
Representative Arford, yes. Representative Melarano.
Yes.
Representative Melarano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart is absent. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. That's 10 yes, 3 absent.
Okay. I have not been keeping a tally of how many bills we voted this afternoon in an hour and a half, but I'm very proud of us for how many it has been. We've been very efficient. Unfortunately, we're not quite prepared for the last bill of the day, which is LD 1466. I have to apologize. It came in a separate email. The bill analysis came in a separate email and we missed it. So we're going to break now until 3 o'clock. We'll come back and work that bill and we'll be done, I think, fairly quickly after 3 o'clock. But we do need to take a small break here.
What was that? 1466? I'm sorry, Madam Chair.
Yes. Yep. So
You send it
we
again,
will.
or do you? Can you
No, we
find it?
have
Oh,
it.
okay.
We just missed.
I forgot.
We went
I
through two
attached this-
emails and we didn't
I
go
know.
through the third. So.
And I attached the same one twice, so I had to send that at that time. So my apologies.
No worries. It wasn't your fault. I just was not looking and double checking the agenda for the day. So, so we missed that one. And I think we need a break at this point. I know I do anyway. And so we will come back at 3 and just work that one bill. We should be done shortly thereafter. Okay. So with that, we'll see folks back here at 3 o'clock. Thanks. Okay, it is 3 o'clock. Okay. Can you guys hear me okay? I'm not really sure where I am here. I keep switching my headphones between my phone and my computer, and never sure where the sound is going to come out. All right. So the last bill this afternoon is LD 1466, an act to improve the efficiency of certain consumer credit protection laws. And Colleen, you have a presentation for us.
So I'll go through LD 1466. There are a number of parts to it. There's parts A through G. It builds upon a bill that was originally considered last session that was put forward by the Bureau of Consumer Credit Protection, and then amended in committee, and reported out of committee, but it was not taken up by the full legislature before the termination of the 129th legislature. So it's been reintroduced to this session, and it reflects the committee amendment supported by a majority of the committee, and also Part G represents a provision that was accepted by the committee, but it was agreed to be added as a floor amendment, although that did never get the chance to happen in a special session. But Part A of the bill does a number of things to sort of make changes to various provisions of Title 9A, as I mentioned, as suggested by the Bureau of Consumer Credit Protection. One, it clarifies their jurisdiction to regulate transactions entered into by mail, telephone, or electronic mail, or using a website when the consumer is located in Maine. It lowers the threshold for when automobile sellers are considered to be regularly engaged in credit sales from the sale of 25 cars per year to 15 cars per year. It defines a supervised lender to include a company that purchases and collects on supervised loans, regardless of whether the company maintains an office in the state. It clarifies current confidentiality protections by cross-referencing a section found in one section of the Consumer Credit Code. It authorizes the superintendent of consumer credit protection to adjust fees and allows the superintendent to reduce fees by rule. It makes some technical changes to correct references to this and update references to the superintendent of consumer credit protection. It specifically provides that the superintendent of consumer credit protection or the superintendent of financial institutions has authority to suspend, revoke, or deny renewal of payroll processor licenses. It confirms the ability of the Bureau to regulate transmission of digital currency such as Bitcoin. It establishes the superintendent's authority over debt collectors, consistent with the authority granted with respect to other types of licenses. It also adds to the laws governing debt collectors routine enforcement authority, consistent with the authority that they have to enforce the laws with respect to other consumer lenders and creditors. And it specifically adds to the debt collector provisions an assurance of discontinuance as an additional enforcement option available to the superintendent, which again is consistent with what's available for enforcement options with regard to other types of consumer lenders and creditors. Part B of the bill makes some changes with regard to the use of the nationwide multi-state licensing system. It allows the use of that system to process licenses and registrations with respect to general creditors, debt collectors, money transmitters, and other entities regulated by the Bureau. It amends a notification date provision in the law to permit the Bureau to use the nationwide mortgage licensing system again for different business types. Part C repeals some language that related or required annual reporting to the legislature relating to the business of legal funding practices. Part D makes some changes to the application and renewal fee provisions for entities licensed and regulated by the Bureau to allow the Bureau to use rulemaking to adjust fees. It allows the Bureau to use the nationwide mortgage licensing system that I mentioned to license and register regulated entities, and authorizes the superintendent to permit affiliated companies to be under a single debt collector license. Parts A to D were included in the original department bill that was submitted to the committee last session, and parts E and F were added as part of the committee's consideration in their process and added through a committee amendment last session. Part E makes it a violation of the Maine Fair Debt Collections Practices Act to collect or attempt to collect a debt from medical expenses against an individual that would be eligible for free or charity care. Part F adds requirements relating to collection actions for credit card debt and student loan debt. And it proposes to move those collection actions out of small claims court and set some standards for the documentation required for those collection actions. And then Part G authorizes courts to refer cases to mediation and assess fees for such mediation. As I mentioned, parts A to F reflect language that was supported last session by a majority of the committee and reported out, but not taken up by the legislature. And Part G was considered and approved to be added as a floor amendment during the discussions that the committee had with the judicial branch about the potential financial impact of the proposal, but it wasn't incorporated into the bill because the bill wasn't enacted because no special session was convened. I did want to point out that the Bureau of Consumer Credit Protection mentioned that an amendment would be suggested from the Entertainment Software Association to clarify the language in the bill related to digital currencies to ensure that the Bureau of Consumer Credit Regulation does not intend to regulate in-game currencies such as used in video games, sort of those virtual tokens that are available. The Bureau has indicated it has no objection to the proposed amendment, which would replace the term digital currency used in the bill and replace it with virtual currency and add a definition of virtual currency. And that amendment is uploaded and was submitted by Curtis Picard on behalf of the Entertainment Software Association. There were some further concerns that were discussed during the committee's consideration of this legislation last session with regard to parts E and F by the Receivables Management Association and Encore Capital Group about the proposal to move certain debt collection actions from small claims court. There were also some suggestions in testimony from Kate Conley, who is an attorney representing creditors and debt collectors, suggesting some changes to the language in parts E and F. And you also might have had some additional information suggesting an amendment to Part E related to how a creditor will be made aware that someone is eligible for charity or free care. And then lastly, the testimony that was provided by the judicial branch suggested that the committee might consider expanding the scope of cases removed from small claims court to all debt collection actions. As I mentioned, the bill proposes the transfer of collection actions related to student loan debt and credit card loans. They indicated that they thought it might help sort of with implementation and make it administratively easier for the court process. And then lastly, with regard to Part G, I did want to point out that the language was included as part of a bill presented this session to the Judiciary Committee, LD 483. And that was a bill that was put forward by the judicial branch and would extend that authority, as I mentioned, to refer cases to mediation. LD 483 was voted out by the Judiciary Committee. Although it has a divided report, the majority ought to pass as amended report does include this language. So you may consider whether or not Part G can be removed from LD 1466, but I would say if you do move it forward with the same language, those sort of conflicts or the enactment of two identical provisions is can be dealt with by the revisor's office through the errors bill or through what's called the revisor's report to address the potential, enactment of identical provisions in two separate pieces of legislation. So it's not critical that you remove it from the proposal. It's just something that you might consider. And then lastly, you don't yet have any fiscal information on LD 1466. And I'll stop there.
Thanks, Colleen. So there's a lot of pieces here, a lot of moving pieces. Let me, Denise, just a minute, please, Representative Tepler. Okay, let me set the stage here. So first, let's pick up Part G first. It's sort of the end, but if we start at the end and then we can work our way back through they're discrete different issues. So that's why I wanted to kind of set the agenda here. So with regard to Part G, having served on both the Judiciary Committee and this committee this year, I guess I would just provide insight that the bill in Judiciary does more than what Part G does. It has other provisions in it. I think, as Colleen said, there's a divided report there, although majority report was, to support it. So I think, my preference would be to leave this in and allow it to be reconciled. It is identical language, I believe, Colleen, is that right? So it wouldn't be a difficult piece of the errors bill, to just be clear that we enacted this particular language twice. Representative Tepler, go ahead.
Thank you, Madam Chair. I agree and would like to keep this piece in the bill. The identical language issue can be dealt with later with references, if need be, from one bill to the other. Once they're in law. The piece I want to talk about is in A through F. So if you want me to hold off till we get up to those sections, because I think there was a change that we made last year that somehow didn't get translated into this bill. And
okay, in which part, Representative Tepler?
It is the piece that involves, let's see. It's the funding, it's the fees.
Yeah, so the fees piece is in the judiciary bill.
Not that fees, the one that allows the superintendent to adjust fees only downward.
Yeah, that part was entirely taken out of this bill as proposed.
Oh, I thought that Colleen said it was not. Because it should have been, and that was a question I had asked originally, was that piece taken out?
Yeah.
Colleen, can you help us?
That. Yeah.
I think I remember a discussion that it wouldn't be in the bill this year.
That's what I remember as well. And when I asked Superintendent Lund about it, he told me, well, I asked him if the language reflected our changes from last year. He said yes, but I'm not sure that piece was.
Yeah, I'll double check it, but I think the language allows lowering of the fees by rule.
Yes.
But I'll double check that.
And the conversation that we had last year was to take that piece out because we didn't like the idea that the fees could be lowered but not raised by rule. Felt that was not appropriate.
Yeah, and let me double check too, because the summary of the bill may not reflect what's in the actual language.
Yeah, and
I'll
so
double
maybe
check it as you're talking about it. Yep.
This may be a good time to invite Mr. Susi to join us because he may have an answer for that as well, because I think that he drafted the bill or worked on the drafting of the bill.
Yeah.
Yes.
So if he's here with us.
He should be.
He's in the wormhole.
He was. He's in the wormhole. Okay.
Okay.
Great. Okay. So we will invite him to comment if he knows the answer to this. It's a very long bill, so I think that's why it's hard to find. Colleen's waving so that her lights go back on in her office.
Yeah,
Mr.
that was
Susi,
what I was doing.
if you're with us, I've done that same motion, so I knew what she was doing. Mr. Susi, if you're with us, if you could unmute yourself and turn on your camera, that would be great. Perhaps he's been stuck in the wormhole. Mr. Susi, there you are. Can you hear us?
Yes, things just
Excellent.
don't. There we go.
Welcome. So can you shed any light on this? We did have this conversation last year as a committee with regard to these provisions about lowering the fees, but not raising them.
I was just looking quickly and I couldn't find it in here. The intention had been to remove all of that and that any changes would be made by rule.
Yeah.
No.
Yeah.
Okay.
And I'm looking quickly too, and I think so too. And I think I think the summary of the bill doesn't reflect what, reflects the prior version from the revisor's office. So I think that's the disconnect. And so I was taking the summary and the analysis. And so my mention of that was inadvertent. So I'll confirm that, but my understanding too, and just looking quickly, is those sections were taken out of the substantive language of the bills. Yeah.
Okay, great. Mr. Susi, I think we'll have you hang with us as we walk through some of the other issues that were identified. So the next issue I'd like to pull up in front of the committee is the issue of virtual currency. And I think the distinction here is between currencies like Bitcoin and Coinbase or whatever. My son knows more about than I do, that is intended to be actually like money, and virtual tokens inside of a video game that can only be spent inside of the video game and are sort of earned and then spent through your actions in the virtual world. And so I think we have language proposed by the Electronic Gaming Association to make clear that we intend to regulate the real financial part, but not the virtual in a fake video game reality place stuff. And Mr. Susi, that was super articulate. Mr. Susi, can you just let us know whether the Bureau is good with those changes.
Yes, we were fine with the changes that Mr. Picard proposed, and I think I sent an email to the committee indicating that it's a fairly simple change, just adding a definition and changing what we designated as digital currency to virtual currency, which brings it in line with basically a standard bill that's being proposed nationwide for states to consider.
Great. Okay, thanks. So the next item of questions that I have on my list is with regard to the scope of debt collection actions, types of debt collection actions that would be moved to small claims court. And the bill is written, talks only about student loan and credit card collection actions, but the evidentiary rules that we're attempting to enforce apply more broadly than that to all debt collection actions. And so Ms. Finn from the judiciary branch had suggested that we broaden the scope of the move as well. So I wanted to get the sense of the committee on that suggested change. Is everybody good with that as an amendment to the bill? Representative Tepler.
Yeah, I want to say that I have come to understand from consumer protection experts that the rules of making the rules of evidence apply in debt collection actions is very important, and that we need to move in that direction and away from small claims actions that actually sometimes leave people more vulnerable.
Any comments on that change to the bill from anybody else on the committee? Okay. And I think then that brings us to this Part E language, which I circulated, but Colleen, it might be helpful if you pulled it up and shared your screen because everybody got it pretty late. It's pretty short. So I think we can review it on the screen.
Yeah. The one you just sent by email, right?
Yeah. Yeah. I just want to make sure everybody's got it.
Yeah. I'm just taking a minute to open up my
documents. So just to set the context for everybody and those who might be listening. So Part E is about debt collection in cases where the debtor might be eligible for charity care. And there was a question brought forth about how the debt collector would be put on notice that the debtor was eligible or potentially eligible for charity care, and also what would happen if then they were determined not to be eligible for charity care. So I think this redraft was an attempt to answer those questions. And I'm good with the language because it seems quite reasonable to me that these are the only ways that one would get put on notice, which is that either the creditor or the consumer would say that the consumer is eligible for charity care. And then once it was clear, or if it became clear that the consumer was not eligible, and the debt collector could be notified of that, and then the debt collection efforts could be recommenced. Yeah. Colleen, do you want to just make it a little smaller so we can see the last line?
I was just asking, can you guys see all this? So I'm gonna.
No, we're missing just it's cut off at the end. There you go. Yeah, so, perfect.
Can you see it all? Yeah. So
yeah.
There you go. Yeah. So yeah, you were just talking about that last sentence there in red, which is the suspension and then recommencing of the action. Yeah.
Okay. So I would offer. Does anybody need any further information on this particular amendment? Are there any questions about this amendment? All right, I don't see any hands going up. So Colleen, you can stop sharing your screen. And then I guess I'll ask you, Colleen, if there are any other issues outstanding that I've missed that you think we were planning to do an amendment on that I've forgotten about.
I don't think so. I mean, you did have those additional suggestions about, objecting to the movement from small claims. That's a policy decision I think you've already made. And then Ms. Conley had suggested some additional changes related to sort of the evidentiary standards, but I think given the policy decision you just made, you've addressed those concerns as well. So
Great.
I think that was all I had.
Okay, wonderful. So with all of those moving pieces kind of having been discussed and laid on the table with some amendments, I would move ought to pass as amended and would look for a second. Representative Matheson has seconded. Is there further discussion on this long bill that does a number of different things? Okay, seeing none, the clerk will call the roll.
Representative Quint. Representative Quint is absent. Representative Connor. Representative Connor is absent. Representative Blyer.
Yes.
Representative Blyer, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Evans. Representative Evans.
You're on mute.
We can circle back around in just a second. Representative Arford.
Yes.
Representative Arford, yes. Representative Melorano.
Yes.
Representative Melorano, yes. Representative Brooks.
Yes.
Representative Brooks, yes. Senator Stewart. Senator Stewart is absent. Senator Brenner. Senator Brenner is absent. Representative Tepler.
Yes.
Representative Tepler, yes. Senator Sanborn.
Yes.
Senator Sanborn, yes. And now Representative Evans.
Yes.
Representative Evans, yes. That is 9 yes, 4 absent.
Okay. So with that, we have finished our work sessions for today. Colleen, do we have any other work?
I don't have any other language review. I didn't get any more fiscals back. So
Okay.
That was it. That's
Great.
13. So our numbers will go up a little bit this week. So that was good.
Yeah,
And all
13
unanimous.
and all unanimous. Good work, committee. Thank you, and have a great afternoon and a good weekend. And we're back to do another marathon work session day on Tuesday. I think it's a lot more than 13. I'm not sure how many it is.
We're up to 27 now, but
okay.
But you were efficient today, so I think you can do it.
Yeah, it only took us 2.5 hours to do 13 today, so so that's good. I would also just remind folks to be looking in their emails for emails from Casey Milligan and others in the LIO who are trying to get reports turned around so that we can report bills out, which helps our numbers as well. So please do go through your emails and make sure you haven't missed any of those. We've got some folks who have been missing them. Representative Tepler, go ahead.
Thank you, Madam Chair. I just want to know whether or not we have any announcements regarding caucus for Tuesday, since we start off with a bang with work sessions.
We'll be in touch. Yeah, I don't have a plan yet, so we'll be in touch on that for our side. Representative Morris.
Same over here. We'll be in touch.
Yeah.
I think it's just
okay.
Representative Blyer and I in here right now, so.
Right.
I'll come join you up there fishing, Mark. How's that?
Perfect. All right. Thanks, everybody. And we'll see you on Tuesday, ready to do some voting.